Assalamualaikum and good morning to one and all. Today we'll study about anti-emetic drug. At the end of this e-learning session, you are able to classify and explain therapeutic uses of anti-emetic drugs and discuss pharmacology of anti-emetic drugs. Let's start with anti-emetic drugs. So first we'll see which drugs are called as anti-emetic drugs. So these are the drugs which are used for the treatment of nausea and vomiting. As I have mentioned in last session, the vomiting, it is something where your GIT content it is expelled. So when the GIT content, if it is expelled out, the condition it is called as vomiting. But when you just feel like vomiting, but content it is not yet expelled out, then such clinical condition it is called as nausea. So anti-emetic drugs are used for treatment of both nausea as well as vomiting. Let's see about the classification of anti-emetic drugs. So there are big category of anti-emetic drugs and there are many drugs which are primarily used for other use. But in addition to their primary therapeutic use, it also having anti-emetic action. So in today's lecture, we are going to see such few class of the drug. So first class of the drug, it is anticholinergic drug like scopolamine. So we have seen scopolamine, it is also used as anti-Parkinson. Okay. So since it having anticholinergic action, it also act as anti-emetic drug. In addition to that, antihistaminic. So we have seen antihistaminic drug in two chapters. One it is the bronchial asthma, and we have also seen the role of antihistaminic drug, especially in case of the allergy. So many antihistaminic drugs, they are anti-allergic in nature. They are also used in case of treatment of bronchial asthma, and in addition to this antihistaminic drug, they are also used as anti-ulcer drug, like they block your H2 receptor and avoid acid secretion. In addition to this, some of the category of antihistaminic drug also possess anti-emetic action. Let's see what are those category. So the category of the antihistaminic drug which possess anti-emetic action are ethanolamine. So it consists of the ethane, that is CH3, CH2 and NH3 group. So these type of drug are called as the ethanolamine. Example, it is diphenhydramine, also got very good anti-emetic action. Second one, it is the piperazine. So drug belong to the piperazine category which having anti-emetic action are the cyclizines and the meclozines. So they are having anti-emetic action. Third category, it is dopamine receptor antagonist. So primarily dopamine receptor antagonists are used for the treatment of psychosis. We have seen many dopamine receptor antagonists, they use for the treatment of psychosis, and they reduces different positive and negative symptoms which is related to schizophrenia or psychosis. So those drugs which having the basic structure of the phenothiazine, example that is aliphatic phenothiazine like chlorpromazine, and piperazine like flufenazine also possess anti-emetic action. So these are the dopamine receptor antagonists that which are specifically used for the treatment of the psychosis. So in addition to having their action as antipsychotic drug, they also having anti-emetic action. There is second category of dopamine receptor antagonists which are not used for the treatment of the psychosis, but they only produces the peripheral action. What do you mean by peripheral action? It means their action it is restricted only to the GIT. They doesn't produces much action on central nervous system. Okay, so such drug including metoclopramide, cisapride and domperidone, they also possess anti-emetic action. So this is the third category of anti-emetic drug. Fourth category, it is the benzodiazepine. So we have seen the benzodiazepines are basically sedative and hypnotic drug. So low dose they produce a sedative action, whereas at high dose they produces hypnotic action. So the drug belong to the category of the benzodiazepine which possess anti-emetic action. It is lorazepam. So lorazepam, in addition to having a sedative and hypnotic action and also anti-anxiety action, it is also having anti-emetic action as their secondary pharmacological action. Okay. Next one, it is the cannabinoids. So cannabinoids, it is the cannabis and dronabinol. So they show good action against nausea and vomiting. The last category of the synthetic drug which having this action, it is serotonin receptor antagonist. So serotonin, what is their chemical name? The chemical name of serotonin, it is 5-HT3. So 5-HT3 antagonist or 5-hydroxytryptamine, it is the chemical name. So out of different 5-hydroxytryptamine receptor, the action specifically on 5-HT3 receptor, it is responsible for their anti-emetic action. And well-known drug belong to this category, it is ondansetron. So ondansetron, it is one of the widely marketed anti-emetic drugs which is sold by brand name of the Ondem. You may have also used the Ondem preparation which is available in the tablet form. Also it is available as the liquid preparation specially for the children and the infant if they are suffering from excessive vomiting. Okay, so these are 6 category of the drugs which produces very good actions against nausea and vomiting. In addition to this, there are some miscellaneous drugs and which are not actually synthetic, but these are directly belong to the natural source, which have show very good action against nausea and the vomiting. And mostly these are used in home remedy for the treatment of nausea and the vomiting. Okay, so example, it is the peppermint. You may have seen the pudinhara capsule, it is available in the medical shop. What it contains, the pudinhara capsule, it consists of the just extract or the juice or of peppermint leaf. Why? Because it having very good anti-emetic action. It also correct the indigestion, right? So sometimes the vomiting, it is related to indigestion, so that can be corrected. Likewise, the ginger, you may have seen your mother when you were small, sometimes they used to give the ginger lemon along with some sugar. So 1 teaspoon of extract of the ginger lemon and the sugar also produces very good action. In addition to that, ajwain. So many the people, especially those who are elderly and believe in alternative system of medicine, you may have seen they are taking ajwain with warm water during the morning. Why? Because it also having very good anti-emetic action, and they also add to improve the digestion of the person. So not only anti-emetic action, they also improve the digestion and they control the nausea and vomiting which is related to the indigestion. So these are different 7 category of the therapeutic approaches that we can avail if patients suffer from MSS. But it's depend upon what type of MSS it is, what underlying disease patient is suffering from, that is responsible for the vomiting. So you must diagnose the root cause of the problem, and accordingly you can give different type of anti-emetic drugs. So this is all about the classification. Next one, let's see about the uses of anti-emetic drug. It is very important and many times it's come for exam for 2 marks. So it is used to treat, as I mentioned, the 2 clinical symptoms. One, it is a nausea, so it is just feeling of the vomiting, yet person has not expelled the GI content. Whereas the vomiting, it is the condition where person has expelled his GIT content. So it is generally used to treat nausea and vomiting which is specially associated with many underlying causes. Like neoplastic disease, a patient suffering from the cancer and neoplastic disease, he undergo treatment, different types of treatment which is responsible for the nausea and vomiting. So and sometimes especially the cancer of the GIT itself produces the vomiting. Okay, so neoplastic disease, it is one of the cause. So in that case you can use. In case of radiation sickness, so there are some patients when they take treatment for the radiation, when they take radiation therapy, so those patients suffer from very severe nausea and vomiting. So you can use in such case as well. Then in case of opioids, so opioids produces when you give through oral route, and there are many drugs, not just opioid, there are many drugs when you give through the oral route, the common symptom it is the nausea and vomiting and GIT disturbance. Okay, and opioid, it is not an exceptional, because opioid produces decrease in gastric motility which produces the constipation, and if the patient is not able to have the proper propulsive motility, then he will not get natural calls. And when food content or your fecal content, if it start accumulating into GI system, that is responsible for these 2 clinical symptoms which is related to the emetic action. Okay, so if opioid produces MSS or nausea and vomiting, then you can have therapeutic options which can increases the GIT motility. So you can see everywhere you are not using same drug. Based on what is underlying cause, you can decide what treatment can be given to that particular patient. Okay, so you can use for the treatment of nausea and vomiting related to opioid. Then cytotoxic drugs, so which is again used in case of the cancer. So many cytotoxic drug produces these symptoms. So you can use for the treatment of nausea and vomiting, which is associated with cytotoxic drug. So the first category today we'll study, it is anticholinergic drugs, and drug belong to this category. It is the scopolamine, which is also called as the hyoscine. So you must know that the scopolamine is basically anti-Parkinson drug which having anticholinergic action, and it is obtained from the natural alkaloid. So it is basically a natural alkaloids which is related to the atropine. Let's see mechanism of action of the anticholinergic drug. So remember that anticholinergic drug, these are the drug which having non-selective action. It means it doesn't work only on the specific receptor, but it produces action on many other receptor as well. So the action of anticholinergic drug on other receptor, it is basically contribute to the side effect. Okay, so let's see their action. So it block M1 receptor, and blocking of M1 receptor, it blocks efferent impulses to the vomiting center. Now what do you mean by efferent impulses? So the impulses which are coming from or which are triggered in your GIT and they are going towards the brain. So those impulses from the GIT going towards the brains are called as efferent impulses. So if these impulses can be blocked, then what will happen? Your vomiting center won't get impulses which are coming from the GIT, and it can easily block the vomiting, and the patient will not suffer from the nausea and vomiting. So this is how the anticholinergic drug, by their virtue of M1 receptor blocking action, they block efferent impulses to vomiting center and thus avoid the symptom related to nausea and vomiting. So this is the first mechanism. Secondly, it is also observed that anticholinergic drug, they reduces the conduction of labyrinthine receptor. What do you mean by labyrinthine receptor? So labyrinthine receptor and vestibular pathway, this is something related to your inner ear, right? And they play a very important role, especially in the function of the hearing, right? And there are some disease which produces the vomiting, and those vomiting are related to your ears. So there is some disturbance in vestibular pathway and labyrinthine receptor which is responsible for nausea and vomiting. Now what these drugs are doing? They reduces the conduction at these receptor. So if conduction can be reduced, then you can easily avoid the vomiting and the nausea. So the reduced conduction at labyrinthine receptor and vestibular pathway. So these are the drugs are commonly used for treatment of motion sickness and the vertigo. What do you mean by motion sickness? Like if you are traveling through the bus. Some patients who are traveling through the bus, they suffer from the vomiting and they also suffer from the vertigo. So such type of vertigo and the nausea and vomiting which is associated with the motion sickness, it is basically related to your inner ear, because continuously you are getting particular sound, and in those patients who are having this problem, there is excessive stimulation of labyrinthine receptor as well as vestibular pathway, and due to that they suffer from the motion sickness. It means whenever they are traveling through the bus or through the train, due to the peculiar sound of that bus and train, they suffer from the vomiting as well as the nausea. Since this drug, they reduces conduction at the inner ear, that is labyrinthine receptor and vestibular pathway, these can be effectively used for treatment of motion sickness and vertigo which is related to the vestibular pathway. So this is how they works and their mechanism of action is. Let's see what are the side effects of anticholinergic drug. So you know that since it having non-selective action, they produces many side effects, like they produces depression of the central nervous system. So the patient suffer from drowsiness, confusion and the fatigue, because your CNS it is getting inhibited due to anticholinergic drug. Secondly, at higher dose, which is generally not used for especially in case of having anti-emetic action. Anti-emetic action you are giving lower dose, but if you give higher dose, or patient has taken 2 tablets instead of 1 tablet, then in such cases it produces the first excitement of the CNS, like he may suffer from euphoria, excitement, hallucination. So these are the symptoms which is related to the excitement. So excitement it happens especially at the higher dose. So it is related to higher dose. and these are the symptoms which are related to the therapeutic dose, that is drowsiness, confusion and the fatigue. Okay, in addition to this, at higher dose, since these drugs belong to the category of anticholinergic, they also produces anticholinergic side effect. And you know, in many chapters you have seen the anticholinergic side effect, like patients suffer from blurred vision, xerostomia, that is dry mouth, where patient salivary secretion it is decreased and patients suffer from dry mouth. The clinical condition or the scientific term for dry mouth, it is the xerostomia. Likewise, they suffer from the tachycardia. There is temporary amnesia, that is partial loss of the memory, and there is raised in intraocular pressure which is related to the glaucoma. So this could be the problem at higher dose, but remember, you are not giving the more dose. So when you are giving treatment for the nausea and vomiting, you must be very cautious about the dose of anti-emetic drugs. Okay, so this is side effect and what happened at the higher dose. Let's see what are the contraindication. So these drugs are contraindicated in patient with the glaucoma. I think you know why it is contraindicated in the glaucoma patient, because in glaucoma patient already there is increased intraocular pressure which is responsible for the severe pain. Now these drugs, they are adding into this intraocular pressure, so there will be more severe increase in intraocular pressure which may lead to complication in the glaucoma. So you must contraindicate anticholinergic drug if patient is suffering from the glaucoma. Okay, secondly, it is also contraindicated in case of prostatic hypertrophy. So when the prostate size it is increased, and remember that the prostate function, that especially they play very important role in case of normal urinations, and if you know there is a hypertrophy of the prostate, the patient urine it is not getting control, so that cannot be controlled if he is suffering from the increase in size of the prostate gland. So if you give anticholinergic drug, it will block acetylcholine, and acetylcholine it is responsible for contraction of the smooth muscle, and due to blockage of acetylcholine, already patients having the complication due to hypertrophy, it will further complicate the condition of patients suffering from prostatic hypertrophy. So you must avoid this drug in two clinical conditions. One, it is patient with a glaucoma, and second one, it is prostatic hypertrophy. Let's see what are the uses. It is used in case of motion sickness, and we have already seen why it is used in case of the motion sickness, because it reduces impulses related to the labyrinthine receptor and vestibular pathway. So this can be the good drug of choice for the treatment of the motion sickness. So we have done with our first part. My second part, it is another category of antihistaminic drug that we'll see in the second part. Okay, so the anti-emetic activity among antihistaminic, you remember that it is restricted to the ethanolamine. So the second category it is antihistaminic. The first category we have seen it is the anticholinergic drug. So amongst antihistaminic drug, do remember that anti-emetic activity it is restricted to the ethanolamine like diphenhydramine, and piperazine like cyclizine and meclizine. So these are the drugs amongst antihistaminic, they only having anti-emetic activity. Otherwise, it is a very broad category. Antihistaminic, they are anti-allergic, they are used in case of the asthma, they are also used in case of the GIT ulcer. So it is very broad category. So only the category like ethanolamine and piperazine, they are having antihistaminic action. So they are not effective against apomorphine induced vomiting, and what it indicates, apomorphine, it trigger your chemoreceptors which are present in the brain. It means the antihistaminic drugs, their antiemetic action, it is not by the virtue of their action on chemoreceptor triggering zone. There is something else which is responsible for their antiemetic action. So let's see about their pharmacology. So first we will say their action, which receptor it is blocked by these drugs. So the receptors which are blocked by these drugs, including they block your H1 receptor which is present in your GIT. It also has anticholinergic effect. So it is not just blockage of the histaminic receptor, but it is also anticholinergic effect which is responsible for their anti-emetic action. Third thing, it also produces depression of neuronal function at labyrinthine receptor. So although your impulses are triggered in the labyrinthine receptor, but since it produces depression of those neurons which carries these impulses, those impulses could not reach to the vomiting center. And if impulses from labyrinthine receptor doesn't reach to the vomiting center, it won't produces the nausea and vomiting, right? And these action, this action on different receptor like H1 blockage action, their anticholinergic effect, and depression of neuronal function at labyrinthine receptor, it make antihistaminic drug as one of the good drug for the treatment of nausea and vomiting. Now let's see what are their effects, in which disease we can use these drugs. So they are effective against treatment of many unique disorder. Like you can use for the motion sickness, and motion sickness we have seen in the detail. So if you are traveling and you are sick, when you are traveling suffering from the vomiting, so you can use it because these are the drugs which depress neuronal function at labyrinthine receptor. In addition to that, there is one disease called as the Meniere disease, where patient vestibular pathway and there is problem something there in the ear, and he suffer from the vomiting and also vertigo. So you can use for the treatment of the Meniere disease, and lastly you can also use for the treatment of vestibular disturbance. So vestibular means it is one of the pathway which coordinates auditory function which is related to the hearing. So if there is any disturbance in this vestibular pathway, so suppose there is reducing the fluid, there is more pressure into your ear, then it is also responsible for nausea and vomiting. So such kind of nausea and vomiting which is related to motion sickness, Meniere disease and vestibular disturbance can be reduced by giving antihistaminic drug. Okay, so we have seen the action of antihistaminic drug. Let's quickly see the side effects. So since it having the action on multiple receptor, obviously they will also have more side effects. So since they having the antihistaminic action, so they produces the drowsiness. They also having anticholinergic action, so they produces the xerostomia, that is dry mouth. So these are the common symptom which is associated at the therapeutic dose. Whereas at higher dose, which may be the possibility that accidentally taken, in such case patients suffer from excitement, convulsion, dilatation of the pupil. So this is very unique, so I have highlighted in the red color. And the flush face, there is increase in a blood supply, there is warm and your face become a warm and red, that is called as the flush face. So this is also one of the problem. And lastly, sometimes patient also suffer from the fever. So these are the symptoms at the higher dose. So as we have seen, the higher dose of these drugs are not recommended at any cost. So even anticholinergic as well as antihistaminic drug, they produces many more severe side effects. So you must be cautious while giving or selecting the dose for the treatment of particular patient. So this is the second category. Third category, it is dopamine receptor antagonist. So basically it is third, there is some inadvertent mistake is there. So we have seen only three categories. So this is your third category. So mechanism of action of dopamine antagonists, how they work. So again, dopamine receptor antagonists, they also having non-selective action. They block your D2 receptor, they also block M1 receptor, and they also block H1 receptor. And you see here, all the blockage of all these receptors can contribute to anti-emetic action, because we have seen M1 receptor blockage reduces the afferent impulses toward vomiting center. Likewise, blockage of dopamine receptor reduces the nausea and vomiting. Likewise, H1 receptor blockage also contribute to the nausea and vomiting. So by virtue of their multitude of action, like action on D2 receptor, M1 receptor and H1 receptor, dopamine antagonist can work as very good anti-emetic drug. Let's see what are the problem. The problem it is, since it having antihistaminic action, it also produces the sedative effect, produces very severe drowsiness. So that could be the problem which is related to dopamine receptor antagonist. Let's see their use. So we'll see few examples. The drug which is widely used, like phenothiazine, we are using chlorpromazine as anti-emetic drug, especially at a lower dose. Remember that chlorpromazine you are giving as an antipsychotic drug also, but their dose is high. Whereas for anti-emetic action, we have used less dose. So same drug, but change in a dose have produces different therapeutic uses. So they are useful in controlling nausea and vomiting, which is specially related to drug toxicity, radiation sickness, gastrointestinal disturbance in case of indigestion, operative procedure. So if patient undergoing surgery, we have seen that before general anesthesia you are giving chlorpromazine. So it played two important roles. It make patient relax because it calm down the patient through his drowsiness that it produced, and in addition to that it reduces the anxiety and comprehension which is related to surgery, which is related to operative procedure, right? And also it reduces the nausea and vomiting. So it can be ideal drug for the treatment of nausea and vomiting, anxiety which is related to operative procedures. So we have seen their use. Let's see what are the action, how it's worked. So remember that the phenothiazine, it's worked through the chemoreceptor triggering zone, and the evidence is that it block apomorphine induced vomiting. We have seen the first two category, anticholinergic and antihistaminic drug, doesn't block apomorphine induced vomiting. So if vomiting induced by the apomorphine, if it is blocked by your chlorpromazine, that indicate that their action it is through chemoreceptor triggering zone. It means it block chemoreceptor triggering zone. Secondly, it also having anti-dopaminergic action, especially on peripheral side, that is in your GIT. If it produces anti-dopaminergic action, that also contribute to their anti-emetic action. Remember that it is ineffective in treatment of motion sickness except promethazine. Why? Because most of these drugs, they doesn't having much action on labyrinthine and vestibular pathway. So they are ineffective in treatment of motion sickness. Only drug which is effective or having some degree of effect, it is promethazine. Okay. Let's quickly see the side effects. So side effect you already know because you have seen the chlorpromazine and you have studied it in the chapter of antipsychotic drug. But I'm quickly going into the detail like sedation. Why sedation? Because it having antihistaminic action. It also produces the hypotension and which is greater in case of aliphatic phenothiazine like chlorpromazine. It produces extrapyramidal reaction like Parkinson-like symptom, which is occur with the piperazine drugs. It produces the obstructive jaundice, agranulocytosis, that is very common, decrease in the level of WBCs. So these are the different side effects, and lastly, it also produces photosensitivity reaction. So if a person is going to the sun after taking this medicine, he may suffer from sunburn. So these are the different side effects which are related to anti-emetic drugs which block dopamine receptor. And lastly, since it having action on muscarinic receptor, it also produces dry mouth, that is the xerostomia. Let's quickly see the contraindication, in which case you can contraindicate. So you can contraindicate in case of patient with bone marrow depression. Why? Because bone marrow depression already it reduces the level of WBCs, RBCs and blood cells. And what these drugs are doing? They produces agranulocytosis. And due to this agranulocytosis, if you are giving to the patient suffering from bone marrow depression, it will further complicate or it will further decrease the level of WBCs, right? And patient may prone to the opportunistic infection. So you must avoid in case of bone marrow depression. You should not give to the hypotensive patient because we have seen the aliphatic antipsychotic drug, what they does, they produces hypotension as one of the side effects. So you should not give in case of the patient suffering from hypotension. It will further decrease the blood pressure. You should not give in case of pregnancy. Why you should not give in pregnancy? Because it having many side effects. It may also affect the infant, and also they are having the effect on endocrine function. And pregnancy, we know that already there is interference of the hormones which may interact with the hormone which are disturbed by your anti-emetic drug, belong to the category of dopamine antagonist. Lastly, it should not be given in case of patient who are having a history of hypersensitivity to the phenothiazine. So this could be the problem. In addition to this, there are two more problems, 3 more contraindications are there, like you should not give in case of epileptic patient as they provoke the seizure, and patient with the glaucoma and prostatic hypertrophy, because these drugs also having M1 receptor blocking action which increases your intraocular pressure, which may complicate a glaucoma, and decreases the contraction of prostatic hypertrophy because it blocks acetylcholine, and acetylcholine is responsible for the contraction of the prostate gland. So these are due to their anticholinergic action. Okay, so these are all contraindications which is related to anti-dopaminergic drugs. So in today's lecture, we have studied 3 categories of the drug. First category was anticholinergic drug that we have studied. Then second category we have studied was antihistaminic, and third category we have studied it is anti-dopaminergic drugs. Thanks for watching my session. If you like this session, then do remember to give me a thumbs up, and for more such learning, subscribe to my channel.